Diabetes, one of the leading diseases of the age, is a disease that can cause many fatal vascular complications if not well controlled. Diabetes is both a metabolic and hormonal disease. Diabetes is very common all over the world. Diabetes mellitus, the full name of the disease, means sugary urine in Greek. In healthy individuals, the fasting blood glucose level is in the range of 70 to 100 mg deciliter. If the blood sugar level rises above this range, the patient is usually diagnosed with diabetes. After a minimum of 8 hours of fasting, a blood glucose level above 126 mg deciliter is a sufficient criterion for the diagnosis of diabetes. Similarly, a postprandial blood glucose level above 200 mg deciliter is another important diagnostic criterion for diagnosing diabetes. Diabetes has many causes. The cause of the disease is insufficient insulin production, which occurs for any reason. Similarly, there is no insulin production in the body in type 1 diabetes, which is especially seen in children and adolescents. The main cause of type 2 diabetes, which is common in adults, is the insensitivity of body tissues to the hormone insulin. Type 2 diabetes is a disease that has many different causes and is usually seen in individuals over the age of 40. Type 2 diabetes is the most common type of diabetes. In type 2 diabetes, also known as systemic insulin resistance, although insulin production in the pancreas is sufficient, insensitivity to this hormone develops. Insensitivity to insulin hormone in the muscles and liver causes an increase in blood sugar. In this case, blood sugar cannot be transported to the tissues by insulin and the blood sugar level rises above normal. This condition manifests itself with symptoms such as dry mouth, weight loss, drinking a lot of water and eating a lot. Sometimes no symptoms can be seen. In some diabetic cases, the first symptoms may be faint symptoms such as fatigue, weakness, impotence and frequent infections. It is of great importance to fully comply with the principles of treatment in type 2 diabetes, which is the primary cause of many different important diseases. Prolonged high blood sugar, it can cause permanent damage to the whole body, especially the cardiovascular system, kidneys, veins, brain and eyes. Individuals diagnosed with diabetes should receive diabetes education immediately and fully comply with the nutrition program approved by the dietitian. No medication is as beneficial as healthy diet, weight control and regular exercise in the treatment of diabetes. Diabetes, which has different variants, is among the most common diseases in the world. According to the statistical data provided by the International Diabetes Federation, although 1 out of every 11 adults has diabetes, 1 person dies every 6 seconds due to diabetes-related problems. Many people live without knowing that they have diabetes. Considering these unregistered diabetes cases, we can say that diabetes is the most common metabolic and hormonal disease worldwide. According to some authorities, 1 out of every 5 people has diabetes. A significant part of the patients are not even aware that they have diabetes because of their ignorance and lack of regular health checkups. Poorly controlled diabetes, it can cause very serious complications such as heart attack, stroke, kidney failure and blindness. That's why you have to be very careful.